Dear students, welcome back. In the previous session, we have discussed about the interphalangeal joints of fingers. Okay, now in this session, we are going to discuss about the extrinsic finger flexors. Okay, what do you mean by this extrinsic finger flexors? Here, the muscles of the fingers as well as thumb which have the proximal attachments above the wrist joint. So above the wrist joint. So the muscles which are having, which are supplying to the fingers and thumb are having their proximal attachments above the wrist are called as extrinsic muscles. And the muscles which are having their attachments distal to the radiocarpal joint or wrist joint. So here, so below this wrist joint, then these muscles are called as intrinsic muscles. Okay. So functionally, these extrinsic muscles and intrinsic muscles are divided into flexors and extensors. Okay, so now we are going to consider in this here is extrinsic finger flexors. We are taking the extrinsic group of muscles which is having the flexion at the fingers. Okay, so there are two extrinsic muscles that contribute to the finger flexion. So they are Flexor Digitorum Superficialis and the Flexor Digitorum Profundus. This Flexor Digitorum Superficialis is the superficial muscles of the forearm, whereas this Flexor Digitorum Profundus is the deep muscle of the forearm. Out of these two extrinsic finger flexors, the Flexor Digitorum Superficialis muscle primarily flexes the proximal interphalangeal joint, but it also contributes to metacarpophalangeal joint flexion. And the Flexor Digitorum Profundus muscle can flex the metacarpophalangeal, proximal interphalangeal and the distal interphalangeal joints, and this Flexor Digitorum Profundus muscle considered to be the more active of these two muscles. With a gentle pinch or grasp, the Flexor Digitorum Profundus muscle alone will be active. When a greater flexor force is needed, or when finger flexion with wrist flexion is desired, the Flexor Digitorum Superficialis muscle joins with that of the Flexor Digitorum Profundus muscle, which increases the activity. Okay, so to understand these functions of these two muscles, first you should know the origin, insertion and its course and also the coverings of all these muscles. Okay, then you can clearly able to differentiate these two functions, which function is carried out by which muscle. Okay, so now we'll start with the Flexor Digitorum Superficialis. Yes, now we will see the origin of the Flexor Digitorum Superficialis. The Flexor Digitorum Superficialis is originating from the humero-ulnar head from the medial epicondyle of the humerus, and also the ulnar collateral ligament and the tubercle on the medial border of the coronoid process of the ulna. So these are the areas where it is originating. That is called humero-ulnar head from the medial epicondyle of the humerus along with the ulnar collateral ligament, and also a tubercle which is present on the coronoid process of the ulna gives origin, and it is also having another origin that is called radial head. So this radial head arises from the anterior border of the radius up to the insertion of the pronata teres. So up to the insertion of pronata teres, this head is getting originating, and also some fibers arise from the fibrous arch passing from the ulna to the radius and connecting the two heads. Okay, so these are the origin of this flexor digitorum superficialis, and this muscle is getting inserted. So if you see at the distal part of this muscle, so this muscle is going to end up into 4 tendons. You can see here the 4 tendons here, and one each for the medial forefingers. These 4 tendons are going to, this one is medial side and this one is lateral side. It is giving each tendon to medial forefingers. That means little finger, ring, middle and index fingers. Okay. So if you see this, how this muscle is getting inserted means, opposite to the proximal phalanx, the tendon for each digit. So if you can see the proximal phalanx, so this is the proximal phalanx. Opposite to the proximal phalanx, the tendon of each digit splits into, so at this proximal phalanx, it splits into two. It splits into two slips. So one is the medial slip and lateral slip, and which are inserted on the corresponding sides of the middle phalanx, and again it is going to inserted on the corresponding sides of the middle phalanx. Okay. So this is the insertion of this flexor digitorum superficialis. Okay, if you see, this is the origin and insertion. What happens in the middle? Okay, so at the wrist, the 4 tendons are arranged in 2 pairs, and it is of superficial pair, and another one is the deep pair. The superficial pair gives branches, that means which supplies the middle finger and the ring finger. Okay, and the deep one supplies to the index finger and the little finger. Okay, the tendons lie medial to the palmaris longus and lateral to the ulnar vessels and nerves. So that thing you can see in relation with the flexor retinaculum, you can understand it. So normally these tendons lie medial to the palmaris longus tendon. Okay, and then the tendon enters the hand by passing deep to the flexor retinaculum, which is enclosed within a common synovial sheath called ulnar bursa. Okay, so these are the things which are seen in the course of flexor digitorum superficialis. Okay, if you see this thing, and in flexor digitorum profundus, so the origin is taking place from the upper 3/4 of the anterior and medial surfaces of the shaft of the ulna. Okay, it is taking origin from upper 3/4 of the anterior and medial surface of the shaft of the ulna, and upper 3/4 of the posterior border of the ulna by an aponeurosis. Okay, so it is getting originating anterior, medial and also the posterior border of the ulna by an aponeurosis, and it is also taking part in origin is by the medial surfaces of the olecranian and coronoid process also. and also some adjoining parts of the interosseous membrane. Okay, all these are the origins of flexor digitorum profundus, and this is going to insert in a way. So this muscle is also end up as 4 tendons, and these tendons are also supplied to the medial 4 fingers, and these tendons are also enter into the palm by passing deep to the flexor retinaculum, and these tendons are also covered by a common flexor sheath. Okay, and opposite to the proximal phalanx of the corresponding digits, the tendon perforates the tendon of flexor digitorum superficialis, and each tendon is going to be inserted at the base of the distal phalanx. So if you can see this thing, so we know that at the proximal phalanx it is divided, the superficialis tendon is divided into two, like this, 2 slips, and it is getting inserted on the middle phalanx, isn't it? So here if you can see this profundus muscle, profundus tendon, so this profundus tendon lies below the superficialis tendon, will come in between these 2 slips, and it is going to the distal phalanx, up to the distal phalanx, up to the base of the distal phalanx it is going to be inserted like this. Okay, so in between these 2 tendons this profundus tendon will come up and gets inserted into the distal phalanx, exactly at the base of the distal phalanx. Okay, and this is the insertion of the flexor digitorum profundus. Okay, and an interesting thing near this insertions of these 2 things, you can see this Camper's chiasma, how this Camper's chiasma is formed. So you can see this thing here, Camper's chiasma. So this one is the flexor digitorum superficialis tendon, and inside you can see the flexor digitorum profundus tendon. Okay, and this one is the proximal phalanx P1, and this one is the middle phalanx, and this one is the distal phalanx. Okay, so at the middle of the proximal phalanx this tendon is splitting like this. Okay, it is giving 2 slips, one is medial slip and then the lateral slip. Okay, and these 2 slips are going to inserted on the corresponding sides of the middle phalanx. Okay, how this chiasma is formed means, in these 2 slips it is having some posterior fibers. These posterior fibers will cross. So the posterior fibers of the medial side will, not all the fibers, some fibers will cross the joint here, and which is going to end up at the lateral aspect of the middle phalanx. The same way the lateral posterior fibers will also crosses the joint, and it is going to be inserted at the medial side of the middle phalanx. So this forms the chiasma tendina. So from here this profundus tendon will cross here, will cross the superficialis, and then it is getting inserted into the base of the distal phalanx. Okay, this is the insertions of the Flexor digitorum superficialis as well as the Flexor digitorum profundus. Okay, so at the transverse section of the, here you can see these tendons, how these tendons are covered by a common flexor tendon sheath, that is ulnar bursa. So this is the transverse section at the level of wrist. So here you can find this one is the flexor retinaculum. So below this you can find here this ulnar bursa and also the radial bursa here. This radial bursa is for flexor pollicis longus tendon, and this ulnar bursa, you can see here it is having two layers. One is the parietal layer as well as the visceral layer here. The parietal layer is continuous with the walls of the tunnel here, and the tendons are invaginated in the visceral layer. Okay, so the upper four tendons are the Flexor digitorum superficialis tendons. It is having two anterior and two deeply placed. The two anterior tendons will supply to the middle finger and the ring finger, and the deeper one supplies to the index finger and the little finger. Okay, and below this four tendons are present which are deeply placed. So these are the Flexor digitorum profundus tendons. Each will supply to the medial four fingers. Okay, yes. So this is the arrangement of tendons at below the flexor retinaculum, and it is covered by this ulnar bursa and this flexor pollicis longus, which is supplied to the thumb, which is also covered by the radial bursa. Okay, and how these coverings are continuous to these tendons, we will see in the next pic. Yes, here you can see here. So these are the ulnar bursa and the radial bursa here, and this ulnar bursa is continuous on the medial aspect, continuous with the little finger, and for the remaining three fingers, that is middle, ring, middle and index fingers. So for these things the radial bursa is ended up at the level of the middle of the shaft of the metacarpals. Okay, and further it doesn't have any coverings, and when it reaches to the fingers it is having separate coverings, that is called finger flexor sheaths. Finger flexor sheaths, and this radial bursa is continuously present over this tendon up to its attachment. Okay, so, and the main function of this bursae are to reduce friction between the tendons and also the structures which are surrounding the tendons. Okay, and these structures also covered inner side by a synovial lining, and which gives nutrition to all these tendons. Okay, and if you see in the case of finger flexors, so it is having different kinds of arrangement. Is that if any infection occurs to the ulnar bursa, is definitely secondary to the infection of the little finger. Okay, so if any infection in the little finger will spread to the ulnar bursa, and then it finally may spread to the forearm space of peroneum. Okay, and the swelling is like that. It results in an hourglass swelling. So like this, it is an hourglass swelling like this. So like this swelling. So swelling is present above the flexor retinaculum, and that is proximal to the flexor retinaculum and below the flexor retinaculum. So at the level of flexor retinaculum, it does not allow to swell. So it shows as hourglass appearance of swelling is seen. And this the same way in the radial bursa. So the radial bursa is also affected if there is any infection in the thumb region. Okay, now we will see how this finger flexor sheaths are arranged, and so these finger flexor sheaths are arranged in such a way that it forms a tunnel like, which allows these tendons to pass in those tunnels. Okay, so now we can see these tunnels here and the arrangement of the fibers. Yes, so in this pic you can see the ulnar bursa and the radial bursa also. Yes, and the arrangement, these fibrous flexor sheaths. So I have already mentioned that these are the modifications of the deep fascia. Okay, this is the modifications of the deep fascia of the fingers, and this fascia is thick and arched. So here you can see the arch like appearance. Okay, across the base of the distal phalanges, and it is also having two kinds of fibers. One is the transverse fibers of the fibrous sheath, and then the cruciate fibers of the fibrous sheaths. So normally these fibrous sheaths are forming an osteofacial tunnel which contains long flexor tendons. If you can see all these arrangements, so all these arrangements forms a tunnel like. Through this tunnel, so here you can see the tendons are passing inside these tunnels. Okay, and these tendons are enclosed in a digital synovial sheath. Okay, and so this digital synovial sheath mainly helps to reduce the friction between the tunnel as well as the tendon, and helps for free movements. Okay, and also this fiber flexor sheath holds the tendons in position during flexion of the fingers. This is the main function of this fibrous flexor sheaths. So now we will see how the arrangement of these fibers are present here. So it is having 5 annular pulleys like structures. So these are also called as vaginal ligaments. So the transverse fibers are called as annular pulleys. Okay, the first 2 annular pulleys lie closely together, which are designated as A1 and A2. Okay, so why? Because the A1 is very located at the head of the metacarpal, and a second larger one, that is A2, which is present on the volar midshaft of the proximal phalanx. So both are very much closely arranged. Okay, so this A1 and A2. So normally in the case of anatomy we have studied this thing as a single one, but here these things are differentiated into like this. Okay. Here the floor of the first pulley is formed by the flexor groove in the deep transverse metacarpal ligament. So it forms a groove. So if you can see, this is the fibrous flexor sheath, and here you'll have the bone. Okay, so it may be a proximal phalanx or middle phalanx or distal phalanx, whatever may be. So this is going to attach like this here. Okay, on the sides of the phalanges. So here this forms the floor, and inside you'll have this superficialis tendon. So above superficialis tendon is present, and below you'll have the profundus tendon. So if you see this thing, it is forming a tunnel like structure. So in this, these two tendons are passing. So at the level of A1, the floor of this A1 pulley is formed by the flexor groove. That means flexor groove means an opening, so through which all these tendons will pass through. So which is mainly formed by the deep transverse metacarpal ligaments. So that is the difference at A1. The remaining A2, A3 and A4, A5, what is the floor which is formed in the remaining pulleys is bone. But in the case of A1, the floor is formed by the deep transverse metacarpal ligament. Okay. The third annular pulley, that is A3, lies at the distalmost part of the proximal phalanx. Okay. And the fourth one lies centrally on the middle phalanx. Okay. So, and the fifth pulley may lie at the base of the distal phalanx, and the cruciate fibers are present in between A2, A3, A3, A4 and A4 and A5. Okay, so such kind of arrangement is seen on the fibrous flexor sheaths of the fingers. The main function of this thing is it holds the tendons in position during flexion of the digits. Okay, so these are all the structures which hold the tendons in hand. Okay, and also the synovial sheaths which are covering these tendons are reducing the friction and permits free movements in the hand and causing the metacarpophalangeal joint flexion and interphalangeal joint flexions. Okay, so now how these structures influence the function of these extrinsic finger flexors, now we will see. Yes. So if you observe the tendons, so how many tendons? So all the four fingers is having one tendon from the flexor digitorum superficialis and one tendon from the flexor digitorum profundus, isn't it? So up to the proximal phalanx, up to the head of the proximal phalanx, so this flexor digitorum superficialis tendon lies superficial, and then it is going to split into two slips. Okay, and this flexor digitorum profundus tendon is lying deeply. That means it is present below the flexor digitorum superficial tendon. Okay, so what happens in such kind of arrangement means the flexor digitorum superficialis muscle can produce more torque at the metacarpophalangeal joints. At the metacarpophalangeal joints than that of the flexor digitorum profundus muscle, because this muscle not only crosses only fewer joints than flexor digitorum profundus, and also it is somewhat away from the joint. So because it is present away from the joint, it is having the capacity to produce more torque. Okay, so the greater moment arm is produced at the metacarpophalangeal joint, which causes more flexion at the metacarpophalangeal joint. Okay, if you see at the proximal interphalangeal joint, here the sum of the fibers I have shown in the chiasma, Camper's chiasma. What happens here? Some of the fibers of the flexor digitorum superficialis, so that is the posterior fibers, isn't it, will lie below the tendon of the flexor digitorum profundus tendon, isn't it? So then what happens? It is almost nearer to the joint, and the momentum which is produced at that level is not enough to produce the proximal interphalangeal joint flexion. So, but this arrangement mainly helps that proximal interphalangeal joint for balancing the joint during motion. Okay, and also it gives stability at that level. So at that level, the flexor digitorum profundus is producing more momentum than that of the flexor digitorum superficialis muscle. Okay, so that means the main flexion which is taking place by the flexor digitorum superficialis is maximum at the metacarpophalangeal joints than the proximal interphalangeal joints. Okay, the flexor digitorum profundus will have maximum movement at the distal interphalangeal joints. Okay. Yes. When the flexor digitorum superficialis tendon is absent, just think that when the flexor digitorum superficialis tendon is absent, forceful pinch activity, that is thumb to finger. So this is the thing, thumb to any fingertip activity of the flexor digitorum profundus muscle may create proximal interphalangeal, so this means proximal interphalangeal extension along with the distal interphalangeal flexion rather than flexion at both the joints. Okay, this phenomenon can be observed in many normal hands because the flexor digitorum superficialis tendon of the little finger is commonly absent or may have anomalous distal attachments. Okay, both the flexor digitorum superficialis and flexor digitorum profundus muscles are dependent on the position of the wrist also for maintaining an optimal length tension relationship. Okay, if there is no counterbalancing extensor torque at the wrist. The volarly located flexor digitorum superficialis and flexor digitorum profundus muscle will cause wrist flexion to occur. Okay. If the finger flexor muscles are permitted to shorten over the wrist, then there may be a concomitant loss in the finger flexion. Okay. So that is the thing happen here. Okay. So these are the things happen during extrinsic finger flexion. Okay. If you see during active finger flexion, the counterbalancing wrist extensor forces is usually supplied by an active wrist extensors such as extensor carpi radialis brevis muscle, or in some instances the extensor digitorum communis muscle. Okay, so the counterbalancing forces for the flexion is carried out by these two extensor muscles. And the mechanism of finger flexion is mainly depend upon the gliding mechanisms and also the wrist musculature for stabilization. The gliding mechanisms mainly consist of the flexor reticula, bursae, and the digital distal tendon sheaths. So what I have explained how these tendon sheaths are arranged, isn't it? So all these are going to help in the gliding mechanism during the movements. Okay, these are all about the extrinsic finger flexors. In the next session, we are going to discuss about the intrinsic finger flexors. Thank you.